They called her just a nurse. That was what Dr. Mercer said, not out loud, but in the way he said her name, like it tasted like something he needed to spit out. Margaret Walsh had worked the pediatric ward at Cedar Creek Medical in San Antonio for 8 months, her soft voice and steady hands earning the trust of frightened children, though never the respect of the department head who saw her lack of a bachelor's degree as proof she didn't belong among what he called real medical professionals. She didn't know yet that this man would try to destroy her. She didn't know that the small folded flag in her locker would become the evidence that saved her life. What she did know was the sound of a child's fear, and how to quiet it with 3 words and a touch. The question was never whether she could survive what was coming. It was whether anyone would believe who she really was before it was too late. Cedar Creek's pediatric ward hummed with the particular rhythm of a place where small humans learn to be brave whether they wanted to or not. The walls were painted a soft sage green, decorated with hand-painted murals of clouds and hot air balloons, someone's attempt at making suffering look cheerful. Margaret moved through the morning in scrubs the color of seafoam, her name badge clipped to her collar, her movements economical and precise. A 6-year-old girl named Sophia sat rigid on an examination table, her small fists clenched. Margaret approached from the side, not the front. Kids didn't like it when adults towered. She sat on a rolling stool, bringing her eyes level with Sophia's. "I have to draw some blood," Margaret said, her voice like still water, quiet enough that you had to lean in to hear it. "It won't take long." Sophia's lower lip trembled. Margaret reached over and touched the girl's forearm, not the arm where the needle would go. "Contact first. Trust second. My name is Margaret." "What's your name?" "Sophia." "Sophia is a brave name. Do you know that?" The girl shook her head. "It means wisdom. That means you're smart. Smart people know that hurt for 2 seconds is better than scared for 10 minutes. Right." Sophia nodded, barely. Margaret prepared the 22-gauge needle, the rubber tourniquet, the collection vials arranged like a surgical ritual. The girl's vein rose beneath her skin, a good stick, Margaret could tell. She'd performed this motion 8,000 times, maybe more. Her left hand steadied the child's arm while her right moved with the muscle memory of someone who had done this under conditions far less forgiving than a climate-controlled hospital room. The needle went in. The flash of blood in the tube. Sophia's breath came sharp, but she didn't cry out. "Done," Margaret said. The word hung in the air like a benediction. After Sophia left, clutching a bandage with a cartoon duck on it, Margaret returned to the nurse's station. The ward was busy but not frantic. A monitor beeped 3 stations down. The intercom crackled with overhead paging. A crash cart sat idle in its alcove, waiting for an emergency that hadn't come yet. Margaret began documenting Sophia's vitals in careful script, her handwriting precise as a military report. Every number recorded. Every observation noted. She had been a meticulous documentarian her entire career. It was how you kept people alive, by remembering everything, by leaving no detail to chance. Dr. Preston Mercer arrived at Cedar Creek Medical in late September, transferred from a private practice in Austin where he'd managed to avoid any serious scrutiny through a combination of family connections and the kind of charm that worked better on administrators than patients. He was tall, with the kind of jaw that looked good in hospital marketing materials and the kind of confidence that came from never having been told no by anyone who mattered. He wore his white coat like it was armor. His shoes were Italian leather, clicking against the tile floor in a rhythm that made his presence felt before you saw him. Margaret was changing before on a sleeping 8-year-old when Mercer entered the room. She didn't look up immediately. She finished securing the line, checked the drip rate, 20 milliliters per hour, no backflow, and only then turned to acknowledge him. By then, he was already watching her, studying her the way a man studies a parking ticket. "Dr. Mercer," she said. Her voice held no inflection, no apology for not greeting him sooner. "Welcome to pediatrics." He glanced at her name badge. His eyes lingered on it for 2 seconds too long. "You're the LPN, then?" "Margaret." "Yes, sir." "No bachelor's degree, correct?" Margaret had heard this before. She'd heard it in the way certain doctors said her title, in the way they didn't make eye contact, in the way they checked her work more carefully than they checked their own. That's correct. We'll need to ensure compliance standards are maintained, he said. His smile was the kind that didn't involve his eyes. Some nurses, not all, of course, have a tendency to skip documentation procedures. Create gaps in the record. We can't have that, can we? Margaret understood what was happening. She'd been in enough hierarchies to recognize the moment when someone decided you were the problem that needed solving. She'd learned, in her first life, how to navigate men like this. How to be invisible. How to survive their attention. The difference now was that she had nothing left to lose, which meant his power over her was more theoretical than actual. But she didn't show him that. She simply nodded, her face arranged in the expression of a woman who accepted correction. I understand, Dr. Mercer. After he left the room, Margaret sat with the sleeping child for another minute. The boy was maybe 7, thin in the way that suggested chronic illness rather than simple circumstance. His mother had gone to get coffee 45 minutes ago. Margaret reached into her pocket and touched the small object there, the folded flag, wrapped around a combat knife, smooth from being held so many times. She didn't remove it. She just felt its outline against her fingertips, the way you might touch a saint's medal, not for religious reasons but for remembrance. The next morning, Mercer called a staff meeting in the break room at 7 a.m., before the day shift properly began. 12 nurses crowded into a space designed for 4. The coffee machine wheezed its morning song, the fluorescent light stuttered slightly, casting everyone in the particular pallor of people who spent their lives under artificial light. Mercer stood at the head of the table. He had somehow naturally claimed this position, though nothing official had given it to him, and opened a manila folder. I've been reviewing our documentation standards, he said. And I found some concerning gaps. Some nurses are not maintaining complete records of medication administration times. Not filling out discharge summaries with the proper level of detail. As department head, I take responsibility for these deficiencies, but I also need everyone to understand that we're going to be implementing a more rigorous audit process. Margaret sat in a folding chair against the wall, a cup of black coffee cooling in her hands. She didn't move. She didn't react. Around the table, she could feel her colleagues shifting uncomfortably, uncertain whether this was directed at them specifically or generally. She'd worked with 3 of these nurses long enough to know which ones documented carefully and which ones cut corners. Mercer didn't mention names, which meant the threat was distributed evenly, which meant it was actually directed at someone specific. She just didn't yet know who. After the meeting, she would learn. Her name had appeared in Mercer's notes 3 times, 3 instances where he claimed her charting had been incomplete or unclear. She had no memory of these incidents. She had no idea how he'd selected them. But the message was clear, he was building something. Not a case, exactly, not yet. Just the foundation of one. A file that didn't exist yet, but would. Margaret returned to her rounds. She had 4 patients this shift, one of them a newly admitted 3-year-old with suspected pneumonia. She sat with this child for 30 minutes, monitoring his breathing, watching the way his small chest moved with effort, listening to the crackle of fluid in his lungs. His father sat nearby, exhausted in the way of people who hadn't slept in days. Margaret didn't speak to him, just worked with the kind of quiet competence that told him his son was being watched by someone who knew what they were doing. Around noon, the ward doors opened and Admiral James Dawson walked through with a child. The Admiral was tall, with the particular bearing of someone who had spent 30 years commanding ships and men. His uniform carried the weight of medals, though he wore it casual, the way people wear power they no longer need to prove. The child was 9 years old, with his father's dark hair and his mother's shaped eyes. The boy walked slightly behind the Admiral, his gaze fixed on nothing, his hands empty at his sides. Margaret knew who this was. Cedar Creek's administrative staff had been informed that an Admiral's child would be coming for a consultation with Dr. Mercer. The file had circulated through the break room. The child's name was Eric. He hadn't spoken in 11 months, not since his mother's death during a combat operation in the Hindu Kush. The Navy's child psychiatrist had recommended a routine evaluation. The Admiral had scheduled it with one doctor in San Antonio who had a reputation for working with military families. That doctor was Dr. Preston Mercer. Margaret watched from the nurse's station as Mercer greeted the Admiral with the kind of warmth he apparently reserved for people with enough authority to matter. Handshake. Eye contact. The full performance of respect. The Admiral shook his hand with the brevity of someone who didn't have time for theatre, and they moved toward the examination rooms. Margaret continued her work, checking medication orders, preparing for the afternoon shift change, updating the board with patient status updates, but part of her attention remained on the examination room door. She didn't know yet why she was watching. She didn't know that this child would change everything. She didn't know that the boy's mother had served on the same SEAL support team that Margaret had been part of, under a name that no one at Cedar Creek Medical would ever recognize. She only knew that something in his silence spoke to her, the way trauma sometimes speaks to trauma, the way the broken recognize each other without introduction. The Admiral and his son came out of the examination room 20 minutes later. Mercer walked them to the door, his manner cordial, professional, exactly what you would expect from a doctor handling a high-ranking patient. The Admiral placed his hand on Eric's shoulder, a gesture that Eric didn't acknowledge or reciprocate. They left through the double doors, and Margaret watched the Admiral's expression as he walked, the careful neutral face of a man holding something together through force of will alone. That was when Mercer caught her eye across the ward. He held her gaze for exactly 3 seconds. In that time, Margaret understood that he had noticed her watching, had interpreted her attention as something it wasn't, and had filed it away as another piece of the narrative he was constructing. She looked back down at her chart. She sipped her black coffee. She did not acknowledge the moment. But she understood, in the way you understand dangerous weather moving in, that something had shifted. By the end of her shift, Margaret's locker had been assigned a small yellow sticker, a routine inventory check, she was told. A formality. But she knew better. She opened it and looked at the folded flag, still wrapped around the knife, still untouched by anyone but her. She touched it once, the way she had touched it this morning, the way she would touch it every morning for the next few weeks while Dr. Mercer built his case against her. She didn't know yet what was coming. She didn't know about the humiliation in exam room 4, the write-ups in red ink, the way the other nurses would stop sitting with her in the break room. She didn't know that her career at Cedar Creek Medical would end with her hand saving a child's life and her life falling apart in the same moment. But as she closed her locker and walked toward the exit, limping slightly on her left leg, a woman who looked like she'd never done anything more dangerous than draw blood, she heard the evening shift arriving. The doors whooshed open. Fresh nurses came in. The ward continued its rhythm, indifferent to the small wars being fought beneath its fluorescent lights. Margaret drove home to her small rented house in Southtown, where she lived alone except for a cat named Operator that she'd adopted after the 3rd tour. She made dinner she didn't eat. She sat at her kitchen table with her laptop and reviewed the narcotics inventory log she'd been secretly maintaining for 8 months, tracking the small discrepancies she'd noticed in the medication cabinet. She didn't know yet that she would need these logs. She didn't know that they would become evidence. She only knew, the way she'd always known, that something was wrong, and that someday it would matter that she'd been paying attention. Outside, San Antonio's evening settled into darkness. Somewhere in the city, an admiral sat with his mute son, neither of them speaking, both of them carrying the weight of a woman who had died serving her country. And in a pediatric ward 5 miles away, Dr. Mercer reviewed his notes on Margaret Walsh's file, preparing the next line of attack. The pieces were moving into position. Nobody knew it yet. But the board was being set. The exam room for door opened at 2:13 p.m. on a Tuesday, and Dr. Mercer's voice filled the space like a tank idling in a garage, low, heavy, impossible to ignore. Margaret stood beside the examination table where 9-year-old Eric Dawson sat rigid in his mother's donated navy sweatshirt, the fabric hanging loose on his small frame. Admiral Dawson occupied the corner chair, his dress uniform sharp enough to cut, his presence making the fluorescent light seem dimmer by contrast. Margaret had positioned her hands on the counter behind her, palms flat, fingers spread, the posture of someone ready to move but choosing stillness. "Nurse Walsh," Mercer said, not looking at her. He was reading Eric's chart, his reading glasses perched on the bridge of his nose like he was examining something distasteful. "Walk me through the medication history. I need to understand what this patient has been exposed to." Margaret's voice came out soft and measured. "Started on sertraline 8 weeks ago. Dose 50 milligrams daily. No adverse reactions documented." "Documented." Mercer removed his glasses and finally turned to face her. His smile was the kind that predators wear when they've already chosen their prey. "That's interesting, because the notes from his last visit suggest confusion about dosage timing. Did you or did you not tell this child's father to administer medication in the evening?" "Evening dosing reduces appetite suppression," Margaret said. "Factual." "Correct. The kind of thing a field medic learns in the Hindu Kush when you're working on soldiers with 3 days of MREs and trembling hands." "I see." Mercer turned to Admiral Dawson, whose jaw had tightened into a line. "What Mrs. Walsh doesn't understand is that sertraline has a longer half-life, and pediatric protocols specifically recommend." "Morning administration," Margaret interrupted. The word came out as a statement, not a question. She watched Mercer's face flush. She knew the protocols. She'd lived the protocols. She'd watched a 19-year-old from Bakersfield die because someone didn't know the difference between half-life and elimination window. Mercer's voice dropped, which meant it was about to become a weapon. "Nurse Charity case," he said, turning so the hallway beyond the open door could hear him clearly. "Perhaps if you'd spent time earning an actual degree instead of whatever online certificate got you this job, you'd understand why we don't let unqualified staff handle complex cases." He gestured toward Eric with the casual cruelty of someone absolutely certain of his dominance. "This boy has already lost his mother. He deserves better than guesswork from someone playing at medicine." The words hung in the air like a smell that wouldn't dissipate. Margaret felt them land, felt them specifically chosen because they were designed to detonate. She could feel Admiral Dawson's eyes on her. She could hear the nurses in the hallway outside the room falling silent. Even the ventilation system seemed to pause its mechanical breathing. Margaret let one tear slide down her cheek. Just one. She didn't blink. She didn't look away from Mercer's face. She wiped it away with the back of her hand and said in a voice that sounded like someone speaking from the bottom of a well, "I've held the hands of dying men who showed more courage than this." The room went dead silent. The kind of silence that comes before something breaks. Mercer's face cycled through colors, white to red to a shade of purple that medical textbooks probably had a name for. "Are you being insubordinate?" "Doctor." Admiral Dawson's voice was quiet, which meant it carried the weight of a man used to being obeyed. "I'd like to speak with you privately. Now." They left the room. Margaret remained perfectly still, her hands still flat on the counter, her breathing steady as a metronomic pulse. Eric Dawson was watching her with the same expression he'd worn since his mother died, the look of someone who'd seen the world rearrange itself and discovered that nothing made sense anymore. He reached out one small hand and touched the scar on Margaret's forearm, the pale line of scar tissue that started at her wrist and disappeared under her sleeve. "Your mom had one too," Margaret whispered. Eric's fingers lingered on the scar. He didn't speak. He never spoke anymore. But his hand stayed there, trembling slightly, and Margaret understood that he was asking a question that had no words. The break room at 12:15 p.m. smelled like yesterday's coffee and someone's microwaved fish from last Tuesday. Margaret sat at the corner table with her homemade sandwich, turkey, tomato, the crusts cut off because she'd learned decades ago that small rituals keep you human. She'd taken 3 bites when the door opened and 3 nurses entered in formation, their body language already calculating the room's social geography. Their names were Karen, Jennifer, and someone newer whose name Margaret hadn't yet committed to memory. She watched them scan the refrigerator, gather their lunch containers, and then deliberately move to the table by the window. The one farthest from Margaret's corner. The newer nurse hesitated. Margaret saw her glance between the corner table and the window table, caught between what her own empathy was suggesting and what her survival instincts were screaming. Karen whispered something. The newer nurse's expression shifted. She picked her container from the counter and followed them. Mercer says she's been skipping documentation, Karen said, her voice pitched low enough that she thought Margaret couldn't hear. Attitude problem. I wouldn't get too close if I were you. They sat with their backs to Margaret, a formation designed to communicate exclusion. She continued eating her sandwich with the same calm efficiency she'd once used to feel dress an arterial wound while rounds were landing 300 meters away. Her hands didn't shake. Her breathing didn't accelerate. She simply finished her sandwich, drank her coffee, and watched the parking lot through the window, watched the delivery entrance, the supply dock, the rotation of trucks that came in at 10:24 a.m. every Tuesday and Thursday. She'd been cataloging them for 6 weeks. The pattern was there if you knew how to look for it. The delivery manifests never matched the receiving logs. 14 cases for antibiotics listed, but only 12 logged into inventory. 3 boxes of surgical instruments signed off by Mercer personally, then disappearing into the hospital supply chain like water into sand. Someone was diverting surgical supplies. Someone with access to ordering, receiving, and documentation authority. Someone whose signature appeared on forms that shouldn't have needed his approval at all. That evening, Margaret updated her encrypted files from her apartment, a nondescript one-bedroom in a complex that didn't have security cameras, the way she'd arranged it months ago. She photographed shipping manifests she'd memorized, cross-referenced them with the medication inventory discrepancies she'd documented, built the connection between Mercer's authorization signatures and the coded language in his emails to a contact listed only as supplier. Her commander's last encrypted message was still open in her secure chat, "We're close." The supply diversion connects to the network's funding pipeline. We need documentation. Physical proof. Timeline is compressed. Pentagon is escalating pressure. 18 months of cover work. 18 months of being just a nurse to a department head who saw her credential, not her capability. 18 months of watching vulnerable children come through the doors of Cedar Creek Medical while surveillance files accumulated in a secure server somewhere that only 4 people in the world could access. The public write-up board occupied the wall outside the staff corridor at 6:41 p.m. Margaret walked past it on her way to the supply room, and her name was there in red ink, 3 times. Printed. Documented. Permanent. M. The Walsh, failure to follow charting protocol, the first one read. She documented the exact medication timing for the Jacobson twins, documented it correctly according to field protocols that would have saved her entire unit if someone had listened in 2019. M. Walsh, unauthorized deviation from treatment plan, the second one said. She'd adjusted a glucose monitoring schedule for a type 1 diabetic teenager based on the girl's specific metabolic patterns, the kind of adjustment that actual medical training teaches you to make. M. Walsh, insubordinate conduct during physician consult, the third one announced to anyone who passed. It was dated this afternoon. Junior nurses paused as they walked by. Margaret watched their expressions shift from sympathy to suspicion to something that looked like fear. The message was clear: proximity to Margaret Walsh was a liability. Mercer had transformed her from a colleague into a contagion. She walked past the board without stopping, but her limp became more pronounced, the old injury from the IED in Kandahar surfacing under stress, the kind of physical tell that confirmed every story Mercer was building about her incompetence. That night, in the fluorescent glare of the break room at 11:44 p.m. when the hospital had emptied out, Margaret sat alone and photographed every supply log from the past 8 weeks. The pattern was crystallizing. Mercer was signing off on surgical supply orders at a volume that didn't match Cedar Creek's actual caseload. 3 weeks ago, he'd authorized a delivery of 47 units of commercial grade for tubing, the kind that was used in field hospitals but had no place in a civilian pediatric ward. The tubing had never appeared in inventory. The receiving paperwork had been countersigned by Mercer and then filed away from the main tracking system. Someone was stealing from a hospital to fund a network that the Pentagon had classified as immediate threat level. And someone was building a case to fire her before she could prove it. The formal performance review was scheduled for Wednesday at 9:51 a.m. The notification appeared in Margaret's employee file at 7:43 a.m., a terse email from Dr. Mercer's assistant citing numerous documented concerns requiring immediate remediation or termination. The email was marked urgent and copied to the hospital's Human Resources Director, the department administrator, and what appeared to be the hospital's legal counsel. But that wasn't the worst part. That wasn't the detail that made Margaret understand the board had been set in a way she hadn't fully anticipated. Admiral Dawson brought Eric back that morning for a follow-up appointment at 8:15 a.m., 30 minutes before Margaret's review. The boy wore the same navy sweatshirt. His eyes were the color of a stormy Atlantic, dark, serious, ancient in a way that 9-year-olds shouldn't have to be. When Margaret entered the waiting room to retrieve him for vitals, Eric reached out and touched the scar on her forearm again. He was staring at it with the intensity of someone trying to read meaning in bone and scar tissue. "Your mom had one too," Margaret whispered again, the same words, because sometimes repetition is the only way to communicate across the gulf of unshakable grief. Eric's hand lingered. And when Margaret looked up, Dr. Mercer was watching them from his office doorway. His expression was calculating, not angry, not yet, but doing mathematics with what he was seeing. A child reaching for a nurse. A nurse whispering something too quiet to be overheard. A moment of connection that didn't fit the narrative he'd constructed about her incompetence. That afternoon, Margaret would learn that Mercer had escalated his paperwork to the hospital's legal department. That he'd called her background check inquiry into human resources, specifically asking about her education credentials. That he'd begun making phone calls to people in places that held real institutional power. What happened next changed everything. The phone call started on a Tuesday morning, though Margaret didn't know it then. Mercer had spent the night making them, his voice smooth as oil through encrypted hospital networks, the kind of calls that moved quietly through administration without leaving fingerprints. By Wednesday, the assignments began. The twins in room 307 were 5 years old, both screaming with respiratory syncytial virus that turned their small chests into battlegrounds. Their mother had left 2 hours earlier for her shift at a processing plant, trusting Cedar Creek Medical to keep them stable. Margaret arrived to find them both in respiratory distress, their oxygen saturation dropping, their small faces flushed with fever. The ventilator in room 307 was already occupied by a teenager with undiagnosed myocarditis, his parents arguing in the hallway about whether he'd been drinking energy drinks. Mercer had assigned Margaret to all 3 cases simultaneously, an impossible triage, deliberately understaffed. She moved between rooms like she was conducting surgery in her mind, calculating oxygen flow rates, for placement, fever management. Her hand stayed steady. Her voice never wavered. But Mercer watched from the nurse's station with the expression of a man waiting for a mistake. It came on Thursday. Margaret had spent 14 hours with the twins, their breathing finally stabilizing, their fever breaking by midnight. She documented every intervention, every medication, every vital sign check with the precision of someone who understood that paperwork was now her enemy. But in the shift change report, she'd mentioned that she'd increased the oxygen flow on twin B by 2 liters without waiting for Mercer's verbal approval, a clinical decision made at 2:24 a.m. when the child's oxygen saturation dipped to 84% and the attending physician was 20 minutes away. It was the right call. The twins' color improved within 4 minutes. But Mercer had already written it up by 8 a.m. The write-up appeared on the public board by noon and sanctioned adjustment to respiratory support without physician authorization. Protocol Violation 4.3.1. Margaret read it the way she'd read casualty reports in the Hindu Kush, with no change in her expression, though her jaw tightened just slightly. One line on the board. Not the last. Over the next 2 weeks, the assignments continued. A teenager with sepsis whose blood cultures Mercer ordered drawn from the 4-line instead of a fresh stick. Margaret caught it, documented it, and was written up for questioning physician protocol. An 8-year-old with possible appendicitis whose abdominal exam Margaret documented as rigid and tender, concerning for surgical abdomen, Mercer ordered observation instead of surgery, and when Margaret flagged her concern in the chart, her entry was highlighted in red and forwarded to administration with a memo about scope creep from nursing staff. Another write-up appeared. Then another. The file was building, thick and deliberate, each entry a brick in a wall Mercer was constructing around her. By the time Admiral Dawson returned with Eric on the second Tuesday, there were 4 write-ups on the board and 2 more in Mercer's office, secured in a manila folder with Margaret's name printed across the tab in black ink. Admiral James Dawson was a man whose presence seemed to alter the air pressure in a room, the kind of authority that came from 32 years commanding nuclear submarines and making decisions that affected thousands of lives. His uniform was dress whites, which meant he'd come directly from Naval Air Station Kingsville, which meant Eric's appointment had been moved up from the Friday slot. Margaret noticed these things the way operatives notice details: the thread count of a uniform, the model of a vehicle, the confidence of someone accustomed to being obeyed immediately. Admiral Dawson held his son's small hand as they walked toward the pediatric consultation wing. Eric was 9 years old, his hair freshly cut, his clothes pressed. He hadn't spoken in 11 months. His mother had been killed in a firefight in Kandahar 23 months before that, and the silence had arrived 3 weeks after the memorial service like a guest who never left. Captain Walsh. Margaret heard her call sign in the Admiral's voice before he spoke it aloud. No. That was impossible. He was looking at the clipboard the desk nurse had handed him. He was not looking at her. The name on the clipboard would say Margaret Walsh, LPN, not Captain. Nobody here knew. Nobody could know. The Admiral's eyes moved past her, scanning the pediatric ward corridor with the same systematic precision he probably used to inspect submarines. His hand rested on Eric's shoulder, and the boy's small shoulders relaxed slightly under the weight of it. Mercer appeared from his office at 2:15 p.m., which was precisely when he'd scheduled Admiral Dawson's appointment. Not 2:10, when the Admiral arrived. Not 2:05, when Margaret had escorted them to the consultation room. Exactly 2:15, because punctuality was a kind of power, a way of demonstrating control over everyone else's schedule. Mercer wore his white coat with the embroidered hospital logo, and his smile was the expression of a man who'd never lost a battle he chose to fight. He extended his hand to Admiral Dawson. "Admiral, a pleasure. Eric's been a delightful patient. We're going to get him feeling better." "Not a question." Mercer's voice carried the tone of a man announcing conclusions he'd already decided on. The Admiral shook his hand briefly, and Margaret watched the handshake the way she might watch a game being played by 2 players who didn't know they were opponents. She remained in the hallway outside the consultation room, updating Eric's chart, her ears tracking the conversation behind the closed door with the muscle memory of someone trained in intelligence work. Mercer's voice was warm, almost paternal. "Eric's anxiety levels have been elevated since his mother's passing. It's completely normal for a child of his age. I'd like to adjust his medication regimen, introduce a compound that should help stabilize his mood and reduce the nighttime terrors his father mentioned." The Admiral said nothing at first. Margaret heard the sound of a pen on paper, Mercer writing, creating the documentation he'd need for insurance authorization. Then the Admiral's voice, precise and controlled, "What medication are you considering?" "We've had excellent results with fluoxetine in children Eric's age, particularly with trauma-related anxiety. I'd like to prescribe a dose of 10 milligrams daily, oral suspension." Mercer's tone suggested this was a conversation about the weather, not about introducing a pharmaceutical into a child's bloodstream. Margaret's hand stopped moving. Her eyes stayed fixed on the chart in front of her, but her mind had shifted into a different operational mode, the kind that required processing information faster than normal thought allowed. She pulled Eric's chart from the file rack, the physical chart, not the digital one, because there were still protocols that relied on paper. She opened to the medication section and traced her finger down his history. Then she moved to the allergy section. Fluoxetine. She knew that name. She'd administered it dozens of times over 6 years of field operations and medical training. She knew its indications, its contraindications, its interaction profiles. She also knew something else. Eric's chart had a flagged allergy documented 3 months ago. Sertraline, another SSRI, had been prescribed for his initial anxiety treatment after his mother's death. He developed a rash within 24 hours, mild but clear, documented in his file and marked with the red allergy indicator. SSRIs. The same drug class. Different specific compounds sometimes meant different reactions, but sometimes they meant the same genetic sensitivity that made a child react to the entire class. Mercer would have seen that flag. Any physician would have seen it. Any physician would have asked about it during the consultation. Margaret moved toward the consultation room door, and the motion was automatic, the kind of action that came from muscle memory and training, and something deeper than training, the instinct that makes a protector move toward threat. She knocked once and waited for acknowledgement. "Come in, Nurse Walsh." Mercer's voice carried the tone of a man who'd expected this interruption and was already prepared to dismiss it. She opened the door and stepped inside. Eric sat on the examination table in his pressed clothes, swinging his legs slightly, looking at his father's face as though to measure whether he was allowed to be anxious. Admiral Dawson stood near the window, his uniform catching the afternoon light like it was reflecting signals. Mercer remained seated, his pen still in his hand, his posture unchanged. "Doctor, I need to verify something regarding Eric's medication history." Margaret's voice was steady, the deferential tone she'd learned to perfect over 8 months, though her eyes moved directly to Mercer's face. "The fluoxetine prescription, Eric has a documented allergy to sertraline, same drug class, flagged in his chart 3 months ago." The room changed. Not visibly. The light remained the same. The walls didn't shift. But the pressure altered, like the moment before a storm, when the barometer drops and the animals all go silent. Mercer's expression didn't change, but his pen stopped moving. He set it down slowly, deliberately, and his eyes moved from Margaret to Admiral Dawson and back again with the precision of a chess player calculating positions. "Nurse Walsh, I don't recall asking for your medical opinion." Mercer's voice remained warm, but something had shifted underneath it, an edge like a knife being sharpened against bone. Eric's sertraline reaction was mild and resolved within 48 hours. Fluoxetine is a different compound with different side effect profiles. "I'm confident in this prescription." Margaret's jaw tightened, just slightly, a movement so small that only someone trained to read people would notice. "I'm recommending we verify with pharmacy before administration." A mild reaction to one SSRI can indicate a broader class sensitivity. Admiral Dawson turned from the window. His eyes moved between Mercer and Margaret with the focus of someone who'd learned to read threats in a single glance. "What's the concern, Captain?" The word landed like a weapon. "Admiral." "Captain." The rank was spoken aloud now, attached to her name, though Admiral Dawson was looking at Mercer, not at her. Mercer's face remained composed, but his hand moved toward his clipboard. He understood what that rank meant. He understood that he'd just been given information he didn't previously have, and that information was dangerous. "There's no concern, Admiral," Mercer said, his voice tight now, the warmth evaporating. "Your son's chart has been thoroughly reviewed. I'm the physician here. I don't require a nurse's secondary opinion on medication selection." Margaret's hands remained at her sides, but her breathing had changed slightly, becoming deliberately controlled, the way someone breathes when they're entering a space where decisions matter. She looked directly at Mercer. "Doctor, I think we should verify." "Nurse Walsh, I don't recall asking for your medical opinion." Mercer stood now, moving from behind the desk, his posture shifting from seated authority to vertical aggression. "Administer the medication as prescribed or I'll add insubordination to your review file." The words hung in the air like a threat spoken aloud, and Margaret understood exactly what they meant. He was offering her a choice that wasn't a choice. Comply and protect her cover, protect her surveillance mission, continue documenting the supply theft that might connect to terror networks operating across 3 continents. Or challenge him, save the child, risk her badge, risk the 18-month intelligence operation that had already cost lives to begin. Eric sat on the examination table, swinging his legs, trusting both of these adults completely. Margaret's hand moved toward the medication cart that she'd brought into the room as standard protocol. The medication was already drawn up, a pre-filled syringe labeled with Eric's name and the fluoxetine dose. She held it in her palm, and her mind calculated angles and time and alternative procedures while her voice remained calm. "I need to verify dosage with pharmacy," she said, the words measured and professional. "It's standard protocol with any medication change in pediatric patients." Mercer's eyes narrowed. "Give the child his medication. Now. Or I'll have your badge before end of shift." The silence lasted exactly 2 seconds. Margaret's hand didn't tremble as she moved back toward the medication cart and secured the syringe in a locked drawer. "I'll confirm with pharmacy and return in 5 minutes." She was moving toward the door when Admiral Dawson stepped forward, his hand raised in a small gesture that stopped everyone. "Doctor, I'd appreciate confirmation from pharmacy as well," he said. His voice carried no request in it, only a command dressed as a courtesy. "My son has experienced medication reactions before. I want this verified." Mercer's jaw tightened. "Of course, Admiral. Whatever makes you comfortable." Margaret left the consultation room and walked directly to the pharmacy, her breathing deliberately controlled, her mind processing options and consequences at the speed of operational thinking. The pharmacy window was staffed by Robert Chen, a PharmD who'd worked at Cedar Creek for 4 years and understood the realities of pharmaceutical safety with the same clarity that Margaret understood them. She handed him Eric's chart and the prescription. "Need you to verify fluoxetine dosage and check for SSRI class sensitivity," she said quietly. "Documented sertraline allergy 3 months ago." Robert's eyes moved across the prescription, then to the allergy section, then back to the prescription. "This is contraindicated," he said simply. "Not that it would necessarily cause a severe reaction, but it's poor clinical judgment. The class allergy should have been noted. Can you document that you caught this?" Margaret asked. "Already doing it," Robert said, his fingers already moving across his keyboard, creating a pharmacy review note that would timestamp his concern and Mercer's clinical oversight. "This goes in the system." Margaret returned to the consultation room at exactly 3:53 p.m., pharmacy confirmation in hand, Admiral Dawson's small nod telling her that he understood something about this situation that extended beyond medical protocol. Mercer accepted the pharmacy's recommendation to use a different medication class, a tricyclic antidepressant with a different risk profile, less likely to trigger a repeated reaction. Eric received his injection at 4:02 p.m., his small arm extended, his trust in his father and these adults unwavering. The medication entered his bloodstream smoothly, without resistance, without consequence. For 3 minutes, nothing happened. Eric sat on the examination table, swinging his legs as before, and Margaret stood near the wall with her hands clasped, watching the child with the focus of someone trained in emergency medicine. Then Eric's breathing changed. His chest rose slightly higher than before, the muscles in his throat working differently, a subtle shift that only someone watching would notice. Then he coughed once, a sound that echoed through the consultation room like a warning. Eric's chest rose higher than before, the muscles in his throat working differently, a subtle shift that only someone watching would notice. Then he coughed once, a sound that echoed through the consultation room like a warning. His small face flushed red, not the pink of embarrassment but the deep crimson of oxygen deprivation. His lips began to swell. "That's not." Dr. Mercer trailed off, his pen still poised over the prescription pad. He'd been so certain of his decision, so confident in his clinical authority. The boy had presented with mild depression symptoms. A standard SSRI adjustment. Quick. Clean. Professional. Eric's hand flew to his throat. His mouth opened and closed without sound, fitting, Margaret thought, because this was exactly how silence looked when it became lethal. She was moving before the thought finished. No hesitation. No protocol review. No internal debate about chain of command. Muscle memory took over, the kind that came from 6 years in the Hindu Kush where you didn't have time to ask permission before someone died. Anaphylaxis, Margaret said, not shouted. Her voice remained flat as a blade. Class allergy interaction. He's blocking. Dr. Mercer's head snapped up. His composure cracked like old paint. That's impossible. I checked, he hadn't checked. They both knew it. Get the crash cart. Call a code. Now. I'm calling a code. He fumbled for the overhead phone, his hands shaking, his voice climbing into panic as he announced the emergency to the hospital operator. His competence, Margaret thought, only extended as far as his confidence. The moment doubt appeared, he came apart. Admiral Dawson had moved to his son, one hand on the boy's back, but his eyes locked on Margaret. Recognition flickered there, not of her identity, but of something else. Certainty. Calm. The particular stillness of someone who'd already survived the worst this world could deliver. Margaret crossed to the supply cabinet in 7 strides. She retrieved the small folding knife from her scrub pocket, the one wrapped in the faded flag triangle from Lieutenant Sarah Dawson's casket, given to her by the SEAL team after the funeral. She unwrapped it with the reverence of a minister uncasing a reliquary. Sarah's name was stitched in Marine Corps blue thread along the fabric edge, barely visible now after 3 years of being pressed against Margaret's ribs. The knife was sharp. She kept it sharp. You kept your tools ready because the moment you needed them was the moment complacency killed someone. Eric's breathing had become a wheeze, the sound of a straw drawing liquid, narrow and desperate. His small fingers clawed at his collar. His face was swelling, the allergic reaction spreading through his throat like a fire through dry kindling. Anaphylaxis moved fast in children. Faster than in adults. Faster than paperwork. Penlight, Margaret said. A nurse, Rodriguez, the one who'd tried to befriend her before Mercer's whisper campaign set in, handed it over without a word. She recognized the authority in that voice. Not the authority of titles. The authority of someone who knew what they were doing. Margaret positioned Eric on his back, tilted his head back gently. The boy's eyes found hers, and in that moment, he stopped clawing. Children knew. They could sense whether the hands touching them belonged to someone terrified or someone who'd held dying men's hands without flinching. I'm going to help you breathe, Margaret said. Don't move. One breath. That's all. She located the cricothyroid membrane by touch, the small gap in the cartilage rings at the base of his throat, the width of a postage stamp on a 9-year-old. She pressed the penlight against his skin, found the membrane by the subtle dip beneath her fingers. The anatomy was the same in children as in soldiers. Cartilage. Membrane. Trachea below. Vocal cords above. 30 seconds. Her hands moved like she was disarming a bomb, each motion deliberate, economical, exact. She incised through the membrane with the blade. The angle precise. The depth controlled. Eric gasped as air suddenly became available, but his body didn't fight her. He understood, this pain meant living. She'd learned that lesson in a forward operating base in Helmand Province. Pain was information. Pain meant your body was still fighting. The bleeding was minimal. She'd avoided the anterior jugular vein by half an inch. She reached for the hollowed pen that Rodriguez had anticipated her needing. This one was already prepared. The plastic shaft opened at both ends, and threaded it through the incision. A makeshift airway. Not ideal. Perfect. Oxygen began to flow into Eric's lungs. His color shifted from crimson to pink to something approaching normal. The wheeze became a rattle, became a steady breath. 90 seconds. That's how long it took. 90 seconds between a boy who couldn't breathe and a boy who could. Dr. Mercer had stopped his code announcement mid-sentence. The phone hung loose in his hand. His face had gone the color of old bone. The child is breathing, Margaret said to the crash team that was now pouring through the doors. She kept her hand steady, her voice level, her eyes on Eric's expanding chest. Maintain airway. Get him to trauma. Prepare for intubation in case the swelling continues. Administer epinephrine IM 0.3 milligrams. 2 units of corticosteroids. She stepped back, her hand still covered in Eric's blood, and didn't look at Dr. Mercer. That would have been satisfaction. She reserved that particular expression for people who'd earned the right to see it. What happened next happened fast, the way hospital codes always did once someone took control. The crash team moved with purpose. Admiral Dawson stayed close to his son's stretcher, his hand on the boy's shoulder, his eyes tracking Margaret as she watched the monitors climb. Oxygen saturation 88 and rising. Heart rate 124, still elevated but trending down. The boy was going to live. The boy was going to be fine. She was already mentally cataloguing what came next. The investigation into why Dr. Mercer had prescribed an SSRI-class drug to a child with documented SSRI-class allergies. The internal review of the medication verification process. The inquiry into whether she'd exceeded her scope of practice. All of that could wait. The boy's airway was patent and functional. Everything else was administrative. But administration moved differently than medicine. By the time Admiral Dawson was allowed to follow his son to the emergency room, Margaret was already in the security office. Dr. Mercer had escorted her there personally, his face tight with something that looked almost like relief. The relief of a man who'd found a way to weaponize the rescue. She performed an invasive surgical procedure without authorization, Dr. Mercer said to the security officer, his voice steady now, his composure reassembled. He was building his case like a prosecutor preparing for trial. Hospital policy subsection 4.7.2 is absolutely clear about unsanctioned invasive procedures. She used a weapon on a patient. A knife. A folded knife from her pocket. His voice rose slightly on that last part, the disbelief of a man who still couldn't quite accept that she'd been carrying evidence of her own capacity. The security officer looked uncomfortable. He was young, maybe 30, with the careful neutrality of someone trained not to make judgments. The child would have died, Margaret said. It wasn't a question or a defense. It was information. That's for qualified physicians to determine, Dr. Mercer shot back. You're an LPN, not a surgeon. You don't have the authority to make life or death decisions. You don't have the credentials. You don't have. The child was in anaphylactic shock, Margaret said. Her voice hadn't changed. His throat was closing. No physician was performing the procedure. You were calling a code. The crash team was 40 seconds out. He had 90 seconds before irreversible hypoxic brain damage. So yes, I did have the authority. Because authority is what you do when nobody qualified is moving fast enough. Dr. Mercer's jaw tightened. He didn't like being corrected. He especially didn't like being corrected by someone he'd spent 8 months trying to diminish. The hospital administrator arrived 20 minutes later. Then the chief of staff. Then a representative from hospital legal. The meeting moved to a larger conference room where Dr. Mercer presented his case with the precision of a man who'd rehearsed every word. The stack of performance documentation appeared, 2 inches thick, he emphasized. The write-ups. The complaints. The patterns of behavior that suggested Margaret wasn't fit for clinical practice. Policy 4.7.2 exists for patient safety, he said, his voice carrying the weight of institutional authority. Allowing unauthorized personnel to perform invasive procedures sets a dangerous precedent. It opens the hospital to litigation. It undermines the entire chain of command. And it happened because this individual decided her judgment superseded hospital policy. The administrator looked at Margaret. She stood with her hands folded, still wearing her scrubs, still wearing Eric's blood. She didn't explain. She didn't defend. She didn't appeal to anyone's compassion. She simply met the administrator's eyes and waited. Your badge, the administrator said finally. I'm sorry, but we have to confiscate your badge pending a full investigation. It took 43 minutes. The security guard walked her to her locker. The other nurses pretended not to watch, but Margaret could feel their eyes tracking her progress down the corridor. The grapevine would be burning by afternoon. The sympathetic ones would feel conflicted. The ones who'd already sided with Dr. Mercer would feel vindicated. In a day or two, everyone would have made their calculations and chosen their positions. Margaret placed her badge on the shelf, the one with her photograph, the one that had opened every locked door in Cedar Creek Medical for 8 months. Below it, she gathered her belongings. A sweater she'd left on the back of her chair. A book she'd been reading during breaks. The folded flag, wrapped back around the knife, pressed to her ribs again. Security escorted her from the building. Not roughly. Not with visible hostility. Just a young man doing his job, walking her to the glass doors, watching her cross the parking lot toward her car. The San Antonio sun was brutal, the kind of heat that made the asphalt shimmer. She could hear sirens in the distance, could hear the rhythmic thud of a helicopter somewhere above the city. Probably coming to Cedar Creek. Probably coming for Eric. She didn't look back. The encrypted message arrived at midnight. Her commander's words were brief because they had to be compromised. Extraction not possible without escalating exposure. Mission suspended pending tactical review. 18 months of undercover work. 18 months of documenting Mercer's supply diversion patterns, of photographing emails, of building a case that connected hospital black market pharmaceuticals to funding streams that traced back to terror networks. All of it was useless now. All of it was dead because she'd chosen to save one child's life. The choice had never really been a choice. Margaret sat at her kitchen table at midnight, still in her scrubs, the folded flag clutched in both hands. Sarah's name stitched in Marine Corps blue. Sarah, who'd replaced her on the SEAL team. Sarah, who'd been killed performing the exact triage duties Margaret had done for 6 years in the Hindu Kush. Sarah, who'd never had a choice at all. Her daughter found her there, small and sleepy, still in her nightgown. "Mommy." The word was tentative, uncertain. "Why are you home early? Why are you crying?" Margaret couldn't explain that some missions fail the moment you remember you're human. 3 days passed in a fog of administrative machinery and encrypted phone calls Margaret didn't make. The hospital's risk management team issued a formal statement and sanctioned invasive procedure, violation of protocol for .7.2, immediate badge suspension pending investigation. The words were sterile and final, the kind of language designed to feel inevitable. But Admiral Dawson didn't accept inevitability. He accepted results. He accepted the fact that his son was breathing, that Eric's oxygen saturation had climbed from 68 to 94 in 90 seconds, that every pediatric specialist who reviewed the case said the same thing: the cricothyrotomy was textbook, perfectly executed, and absolutely necessary. He also accepted that bureaucracy moved like a tanker, slow and heavy, but admirals commanded tankers. He demanded a full review of the incident, every video, every monitor strip, every second of what happened in that exam room. He made calls that moved through channels most people didn't know existed. By the afternoon of day 4, someone in the Pentagon flagged a name in the federal database. Captain Margaret Walsh. Security clearance active. Classification level, TSSCI. One phone call to the hospital's board president began the avalanche. The conference room where they gathered on Friday morning, the same room where Dr. Mercer had built his case against Margaret with documentation and whispered credibility, now held a different energy. Margaret sat in dress white she hadn't worn in 4 years, the uniform hanging on her frame like a ghost remembering a previous life. The jacket bore for ribbons, a bronze star, a silver star, 2 purple hearts. No one looked at her directly. Admiral Dawson stood by the window, his face carved from granite. Across the table, Dr. Mercer smiled, a reflex, automatic, the smile of a man who still believed the room belonged to him. The hospital board president opened a laptop. On the screen, frame after frame of security footage, Mercer's hands pulling up Eric's chart, Mercer's finger scrolling past the documented SSRI allergy, Mercer's mouth moving as he prescribed fluoxetine anyway. The footage had no sound, but the intent was audible. Mercer's smile flickered. Then it died. A Marine investigator stepped forward, pressed a folder flat against the mahogany table. His name was Captain Holloway, and he read with the precision of someone who had testified before military tribunals. He read from Sarah Dawson's Silver Star citation, words written by commanders who had watched her work under fire in Kandahar, Kuna Province, 2019. The citation mentioned her valor, her calm under hostile fire, her refusal to leave wounded soldiers. It also mentioned her recommendation to expand field emergency procedures for Navy corpsmen and nurse officers, a recommendation that had been implemented service-wide. Sarah Dawson had been changing policy from the Hindu Kush. She had trained Margaret Walsh personally. The two words that hung in the air were not spoken, like mother, like daughter. Dr. Mercer's face went white. Not from embarrassment. From comprehension. He had been building a case against someone whose clearance sat 3 levels above his ability to access it. The door opened at exactly 9:44 a.m. A 2-star general entered, his presence shifting the room's pressure like a storm front moving inland. His name was Raymond, and he carried nothing except authority. He moved directly to Margaret, not to the board president, not to Admiral Dawson, but to the woman in dress whites, and executed a formal salute. His hand rose to his temple with the precision of a man who had saluted presidents. Margaret returned it, her arm steady. The general's hand moved from his temple to Margaret's shoulder, then to each ribbon on her chest, touching them as if cataloguing history. The gesture took 7 seconds. It felt like an era. Dr. Mercer stood, opened his mouth, began talking about hospital jurisdiction and personnel matters and policy violations. His voice climbed. His hands moved. General Raymond turned toward him with the expression of a man watching an insect walk across a tabletop. Mercer stopped talking. The Admiral nodded. Once. The IT director rose, a former Army sergeant named Mitchell who had spent 20 years securing military networks before taking civilian work, and placed a hard drive on the conference table. Then a stack of printed emails, each page timestamp dated, each one showing the same pattern. Mercer's prescription of unnecessary medications tied to specific supply requisitions. Mercer's deletion attempts, sloppy, traced, recovered by someone who understood how to follow digital footprints. Messages to an outside distributor, names redacted but chains of money visible, $847 here, $2,100 there, accumulating into patterns. The distributor was based in Dubai. The supply chain led to networks flagged by Defense Intelligence Agency. Eric wasn't Mercer's first victim of negligence. He was simply the first one whose father could mobilize the federal system. Sergeant Mitchell played the security footage frame by frame. There, Mercer's hand reaching toward the keyboard to delete files. There, the timestamp showing he'd worked for 37 minutes after Margaret's termination, trying to erase evidence. The footage showed his face, the concentration, the fear, the moment he realized someone was watching everything. The hospital board met for 90 minutes without Dr. Mercer present. When they reconvened, the board president's voice was flat, procedural, the tone of someone reading a verdict that had already been decided in some deeper, colder part of the institution. Gross misconduct. Ethics violations. Endangerment of patient welfare. The same phrases Mercer had used to build his case against Margaret now wrapped around his own throat. His medical license was suspended immediately pending investigation. His office was sealed. Federal agents arrived at 1:15 p.m. with a warrant and 3 large boxes. By 3:16 p.m., the other doctors and nurses who had avoided Margaret in the break room, who had whispered about her attitude problem, who had accepted Mercer's narrative without question, now moved through Cedar Creek's corridors in a different kind of silence. Margaret walked past them in her dress whites, and their eyes found the floor tiles instead of her face. The public write-up board, that monument to Mercer's careful documentation, was photographed by hospital legal before being taken down as evidence. 3 weeks later, a pharmacy director gave a deposition. He'd noticed supply discrepancies months ago, but Mercer had assured him it was administrative reorganization. A nurse practitioner admitted she'd watched him deleting files but was too intimidated to report it. A DEA investigator traced the supply diversion to a network financing terror operations in 3 countries. The dominoes fell with the weight of things that had been unstable all along. The medication distributor was arrested trying to board a flight from San Antonio International Airport. The supply chain unraveled. By midsummer, Margaret received notification Dr. Mercer's medical license, permanently revoked. The word permanent had the weight of a name carved into stone. 6 months after the hearing, a junior nurse named Cassandra spotted someone at a community college job fair near downtown San Antonio. The man wore a polo shirt with a community college logo. His nameplate read Instructor Mercer. No title. No doctorate. $13 an hour teaching CPR fundamentals to nursing students who would never know he'd once commanded a pediatric ward. Cassandra watched him turn toward her, recognize something in her expression, and look away. That was his existence now, the constant small recognition that everyone knew, and the constant turning away. Power had extracted its price. But that wasn't where Margaret's story ended. Cedar Creek Medical offered her position back, her old job, her title, a promotion to clinical supervisor, back pay for the months of lost wages, a formal apology typed on hospital letterhead. She declined. The surveillance mission she'd been running had succeeded despite everything. The supply theft ring was dismantled. The terror financing networks were disrupted. 3 countries received intelligence reports about disrupted cells. But success had cost her cover, and cover was a thin veil that once torn could never fully be rewoven. Instead, she accepted a position at the VA hospital across town in a dedicated capacity working with combat veterans. She needed to work with people who understood what it meant to carry things no one else could see. Her dress uniform hung in her office where patients could see the ribbons. They would know, by looking at the fabric, that she understood. They would know she wasn't just treating them. She was remembering. The pediatric memorial garden at Cedar Creek Medical lay quiet on a Saturday morning in October, 362 days after the day that changed everything. Margaret knelt on the path in her dress whites, her knees pressing against the warm Texas stone. Eric Dawson stood beside her, his small hand moving toward the ribbons on her chest, touching each one with the careful attention of someone learning a new language. Admiral Dawson stood at the garden's edge, his hand over his heart, watching his son speak his first real sentence in 13 months. Not a test sentence. Not a therapy sentence. A real one, carried on breath that came from somewhere deep. "Why do you have so many of those?" Eric asked, his voice thin and uncertain, like a radio signal traveling a great distance. "Because I made choices," Margaret said, and the words came out as a simple truth. "Some of them hurt." She held up her palm, where a small knife scar had become permanent geography. "But we make them anyway." The folded flag sat on the garden bench between them, catching the October sun. It was Margaret's own flag now, not Sarah Dawson's. It would stay with her until her service ended, whenever that would be, if it ever ended at all. The texture of the flag's fabric was rough, worn soft by time and hands. The smell of the garden was green and growing, the sound of traffic distant on the street beyond the walls, the sound of the world continuing on, indifferent and beautiful. "My mom was brave like you," Eric whispered. Margaret turned toward him, and for a moment she was kneeling not in San Antonio but in every garden where soldiers had been buried. "She taught me that too," Margaret said. Admiral Dawson approached, extended his hand to help Margaret stand. She took it. His grip was steady, the grip of a man who had learned to hold on to what mattered. "My daughter wrote about you in her last letter," the Admiral said. "She said you taught her that rank is what they pin on you, but honor is what you do when no one's watching." Margaret stood, still holding his hand. "She taught me the same thing," she said. Eric moved between them, reaching up to hold both their hands. The 3 of them walked toward the parking lot, a child who had finally found his voice, a father who was learning to trust the living again, and a woman who had saved one life and been willing to lose everything to do it. The camera could have held on them, following their silhouettes across the garden path, but instead it held on the bench, on the folded flag catching the Texas sun, on the hospital windows reflecting the 3 figures walking away toward whatever came next. Some missions end. Some just change direction. Margaret Walsh had learned the difference. If you've made it this far, you already know who she really was. But more importantly, you've learned what she chose to be. Subscribe for more stories about people no one suspected. Like this video if you believe hidden strength deserves recognition. And comment, have you ever been completely wrong about someone?